All right, let's take a look at the daily stats. All of these stats are as of 5:30 a.m. from Johns Hopkins. Total confirmed dates. We're now over 100,000. The confirmed cases, that's up about 5,000 from yesterday. Total confirmed deaths are up about 100 from yesterday to 3,408. Just so you know, before we did anything with the swine flu, there were 1,000 deaths in America. 1,000 deaths in America. There are now 55,812 patients who have recovered from COVID-19. That's about half. Doctors point out the recoveries are outpacing hospitalization or deaths. 94 countries have confirmed cases. That is up from 87, and 11 more today have suspected cases. 16% of active cases are considered serious. Have you noticed this number is coming down? It was just at the beginning of last week, I think 19%. It's now down 3 points. 16% are considered serious, requiring hospitalization. That is including 5% that require ICU. The U.S. now has 233 confirmed cases, 14 deaths. The confirmed cases now in Washington, Oregon, find your state, California, Arizona, Texas, Wisconsin, Illinois, New York, New Jersey, Massachusetts, New Hampshire, Rhode Island, North Carolina, Georgia, Colorado, Tennessee, Nevada, with additional suspected cases in Montana, Nebraska, Minnesota, Ohio, Pennsylvania, and Virginia. Now, some other news that you need to know about this. We have the EPA releasing a list of disinfectants to use against the coronavirus. So if you're looking to disinfect, you should look to the EPA list of disinfectants that you can use. Clorox multi-surface cleaner and bleach, Clorox disinfecting wipes, Clorox commercial solutions, Lysol brand heavy-duty cleaner disinfectant. There's all kinds of Purell, Saniprime, germicidal spray. The CDC and FDA has made this now available in case you are looking for those things, but it's all just common sense, unlike what Tito's has had to come out and say. Tito's Vodka, based in Texas, has responded on Twitter that no, their vodka is not a sufficient disinfectant against COVID-19. A Twitter user wrote in and said, "I made hand sanitizer out of your vodka. Hand sanitizer doesn't taste bad either. Cheers to Tito's." They responded immediately. Per the CDC, hand sanitizer contains at least 60% alcohol. Although ours is delicious, it's only 40% alcohol. Therefore, it doesn't meet the standards of the CDC. Despite the company's tweet, more than a dozen Tito's vodka sanitizer recipes are currently circulating online. I wonder if this isn't just a brilliant marketing campaign. Also, there is another rush. We've heard about toilet paper flying off the shelves and other things that now have, kind of a black market feel to them. Alongside those coronavirus prep bags being filled by shoppers, bleach, hand sanitizer, are now, add to it, Twinkies and Ding Dongs. Hostess brand, the CEO said that they're seeing a bump in business as people are stocking up in case they are trapped at home during the coronavirus outbreak. We are benefiting likely for short-term due traffic, and that's the great thing about Hostess. They're comfort things, so seeing a slight uptick in traffic too early to tell, but a lot of our sales data is lagging, but we think that this is just people storing up for a comfort food. The average Twinkie and Ding Dong package sold today will last you, not as long as food storage, but it will go to 2024. By the way, I opened up the vault yesterday because we saved Twinkies, when they stopped making Twinkies. When was that? Stu, do you know?
A couple of years ago, right? But they're back now. But,
yeah. They didn't last very well. I put them in a vault just so we had them as a joke. And yesterday I was kind of cleaning out some of the stuff in the vault, and I found the Twinkies in the back of the vault. I wouldn't eat them.
So wait, because everyone used to say, I'm not going to eat those things. They'll last for 40 years.
No.
And now
no.
they don't last for 40 years, and that's another reason why you won't eat them? Maybe you just don't like Twinkies. Right?
That's true. I don't like Twinkies. But the Ding Dongs, I love Hostess Ding Dongs. Yeah, they didn't weather the years very well either. Hundreds of concerts and events have gone offline now. Trade shows, concerts, events been canceled due to the coronavirus fears. In the U.S., more than 41,000 people have signed an online petition calling for the cancellation of South by Southwest. That is a 10-day tech and music concert that normally draws about 400,000 visitors to Austin, Texas. People are saying, please don't come. Please don't come. The Global Health Conference, where Donald Trump was scheduled to speak, it is the first cancellation in the event's 58-year history. The Global Health Conference, that has been canceled. American Bar Association canceled its national conference on white-collar crime. Natural Products Expo is canceled in Anaheim. 32nd Annual Arnold Schwarzenegger Annual Sports Festival in Columbus, Ohio.
No.
Could I just go back and read that again?
Mm-hmm, sure.
The 32nd Annual Arnold Schwarzenegger Sports Festival in Columbus.
Mm-hmm.
Did you know that he had a sports festival
I did not.
in Columbus?
No.
And it ran for 32 years? No idea. In our Don't Be a Tool category, New Zealand residents who had a fever and had symptoms attended a live Tool concert on February 28th. The packed rock concert was packed with thousands of other people, and health authorities are now using security cameras to identify who he may have come in contact with. He was in the general admissions standing area from the left-hand quadrant, they say. He stood in line for refreshments. He used the restroom. Don't worry, if you're in New Zealand, if you were there and had any refreshments, were in the stadium, or used the bathroom, you might be infected. A man in his 40s in Slovakia confirmed now with COVID-19. No international travel. Son doesn't live with him, who had traveled to Venice in Italy in January. 2 additional suspected cases now in Slovakia have no known exposure in the international travel. They don't know how it got there. China's economy is losing $20 billion every day. Migrant workers and contractors are the worst impacted, could lose a combined $115 billion by April 2020. Total economic loss in China mount. They could exceed $1 trillion in lost income among Chinese households. Let me say that again. Not in the businesses, but in the households. It could exceed $1 trillion in lost income. This is the real threat of the coronavirus. Bank of China has made $200 billion available for Chinese small businesses. Bank of China also purchased $100 billion in Chinese stocks and bonds. The Chinese stock market has gained 9% so far in March. Much of that is printed money by the Chinese. But I will tell you, when we finally hit the bottom on this, nobody can predict the top. Nobody can see the bottom. But I will tell you that once we find a vaccine, which will happen, once we find the vaccine, and once we know that a socialist Marxist is not going to win in the election, you should have your money in the stock market, because the stock market will boom once we get past all of this. It's down again, another 535 points at this point. It is down to 25. That Dow is 25,595 currently. That's down from about almost 30,000 just a few weeks ago. So we're down 5,000 points. But I would imagine that our stock market is going to rebound. The great news is on this politically is we were due for a correction. And if it wasn't for the coronavirus, when that correction happened, the press would immediately say, Donald Trump's economy is falling apart. Not one of them would have said, hey, by the way, it looks like Barack Obama's economy is really kind of falling apart. Because remember, this is Barack Obama's economic policies that brought us here in the good times. Nobody would have blamed the bad times on Barack Obama. But if Barack Obama were in office, if the exact same thing happened, he would still be blaming it on George W. Bush. Okay, so Stu, I've got something for you to listen to, and you tell me what's going on.
Okay.
This is circling the internet right now, and nobody is pushing back on this. We will now have some breaking news on this. This is a nurse, and she says the CDC would not test her. She is a union leader. She released a video Thursday afternoon where she read out that she was working. Well, let me just play it for you. Here she is. Listen.
I'm going to read a statement from one of our quarantine nurses who works at a Northern California Kaiser facility. She chose to share her experience anonymously, but she is hoping that her story can be elevated to raise public awareness about concerns for the coronavirus response. She said, "As a nurse, I'm very concerned that not enough is being done to stop the spread of the coronavirus. I know because I am currently sick, in quarantine, after caring for a patient who tested positive. I am awaiting permission from the federal government to allow for my testing, even after my physician and county health professional ordered the test. The national CDC would not initiate the test. They said they would not test me because if I were wearing the recommended protective equipment, then I wouldn't have the coronavirus." What kind of science-based answer is that? What
denier.
a ridiculous and uneducated response from the department that is in charge of the health of this country. Later, they called back, and now it's an issue with something called the identifier number. They claim they prioritize running samples by illness severity and that there are only so many to give out each day, so I have to wait in line for the results. This is not a ticket dispenser at the deli counter. It's a public health emergency. I'm a registered nurse, and I need to know if I'm positive before going back to care for patients.
Right, you do.
I'm appalled at the level of bureaucracy that's preventing nurses from getting tested.
Okay.
Delaying this test puts the whole community at risk.
Okay, stop. What do you think's going on there, Stu? What do you think's happening?
I mean, there's not enough information for me to really know, but
Well, it's weird, isn't it?
yeah.
Yeah, go ahead.
My guess would be that we, and this is pretty well publicized, we don't have enough tests for people to
So
utilize
if you
yet.
go in today to a hospital and you say, I'm pretty sure I have the coronavirus, I don't feel well, what is the doctor going to do with you?
Probably isolate me or tell me to go home and
Go
self-quarantine.
Correct. Why?
Because they don't have tests yet.
Right. We don't have
The
enough tests.
They've ramped up production. They believe they'll have over 1 million by next week, but
yeah,
they're
but
not.
that's 1 million for the entire country.
Right.
So it's best until we get that going to just isolate people and only use those tests on the people who are showing real symptoms so we can get them in. You don't have, at this point, we don't have the tests. This is, by the way, socialist healthcare. This is what it's like when you don't have enough, you have to ration. And so not everyone gets to the deli counter to ask for their meat when they want their meat. Okay? Now, this is a union worker. She said that she wants to know if she is sick and has it. And she calls the government basically science deniers, uneducated, and why should I have to wait in line? Well, sweetheart, if I may use that, I understand your personal concern, but if you're somebody who's in a union and had been somebody who's been supporting socialized healthcare, that's what this is all about. A line. And you know why there's a line? Because right now, only the government has been making these. Donald Trump and Mike Pence and his team are trying to get all of the capitalist companies to make more of these tests so you could buy them at CVS, just drop it in, and you'd be able to get that test done, and you'd know right away. Until that time, the government has full control. And yes, we don't have tests to test everybody who thinks they might have it. By the way, we reached out to the CDC yesterday. Here's what they said. CDC is not aware of this individual case. We cannot respond to its specifics. However, the CDC would most definitely recommend a healthcare worker who had contact with a confirmed case and then become ill be tested. At all times, clinicians have discretion to test patients based on their individual assessment of that patient's illness and risk of exposure. Our clinical team is working with state and local health officials to assess persons under investigation and has not said no to any such request for testing. I'm telling you right now, you be careful who you're listening to. You have to really be careful and question everyone's motives. And I urge you to question even mine. I'm telling you that I'm coming with no motive other than to tell you the truth as I understand it and give you perspective. But you shouldn't take my word or anybody else's word for true on any of this. You must do your own homework. You have to think these things through. Is this possible? Yes. But the most logical thing is there are no kits. There's not enough. You think you have it? I'm sorry. I can't give it to you on I think you have it. We have people waiting for the tests who could get medicine right now as soon as we get a test back confirming that they have COVID-19. You're not the priority right now. That's the world of socialized medicine, union leaders, union lovers. Welcome to it.